Good day, my dear postgraduate and dependent students. Welcome to our new session on Glide the Slide. Last week, we had been given a homework with a slide carrying a history of a biopsy from a 36-year-old male presenting with fever, loss of weight, and arthralgia. Always I used to tell you people, every word in the history matters. Glide the slide 13. Now, what I would like you people to kindly do is to describe. We need not know the diagnosis. In fact, we might not be knowing, but describe. So, I am finding an intact epithelium, a columnar, and then the goblet cells are there. And in the lamina propria or the submucous region, I am finding a few glands. But there is a widening of the lamina propria and a pale appearance that is striking. Always, a diagnosis of the size of a cell is made out by the distance between the adjacent nuclei. So, any guess what it could be? It is a case of Whipple's disease. And this is George Hoyt Whipple, 1907. And he had won the Nobel Prize, was a Nobel laureate for this. The Whipple's disease, it has to be differentiated from the Whipple's procedure, etc. It is a systemic disease caused by bacteria Propherema whipplei. So it is a bacterial disease. Malabsorption, multiple asterisk marks have been given, is the classical feature of it. Though the patient can present with weight loss, diarrhea, arthralgia. In fact, in one of my classes on synovial biopsy, I had mentioned arthralgia. Lungs and eyes can also be included. Now, this is a scanning electron photograph of Propherema whipplei from Imagine, the cerebrospinal fluid, and in the fibroblast culture. And these are the references for it. I would like you people to kindly be courteous to Journal of Infectious Diseases 2003. Thanks to ResearchGate for this wonderful picture. And here again, I am able to see multiple rod-shaped organisms under the scanning electron microscope. Now, what is the route of spread? Assuming and presuming that it is a disease of malabsorption, it has been suggested that oral would have been the route of infection. Duodenal biopsy is diagnostic. The other diagnostic modalities can be electron microscopy, PAS positive for the macrophages, fluorescent in situ hybridization, and polymerase chain reaction in the saliva. Something we will have to learn so that if you do get a question on malabsorption, this will add on to it. Now look at this. There is a kind of rugosity that is being developed in the mucosa. So it is somewhat a little rigid. At the same time, I find that there is a change in the complexion and the texture of it. The book, particularly Robbins, describes it as a bare skin drug appearance. I hope you are able to compare it with this. So there is a bare skin on one side and the endoscopic picture on the other. Kindly compare. Now, what do I see microscopically? I had shown you a slide earlier, but then this is a lower magnification in which I am able to see still the villi are there, though there is some amount of atrophy of it. And there is a widening of the villi, narrowing of the crypts. So what will happen is there is an infiltration with large pale cells. These are Brunner's glands, do not mistake. There are large pale cells rather, arranged in sheets. The glands themselves are devoid of any pathology. And these are the foamy macrophages in the lamina propria, courtesy Wikipedia. And this is a higher magnification of the Whipple's disease. See, very clearly it has been made out. In fact, if you observe very carefully, the cells themselves have got fine vacuolation in the cytoplasm. The nucleus is almost central, and the space between the nucleus is the area divided between two cells for the cytoplasm. Foamy macrophages in the lamina propria. And if a special stain such as PAS, periodic acid shift, is done, this particular stain is not HNE, it's a periodic acid shift and an Alcian blue. I find that all these foamy cells have taken up a magenta color, positive for glycogen. So that is color. Without black, no color has got any depth. So probably, I do not know what they are meaning. A lot of philosophy has got in these words. Let us glide to the next slide. A 10-year-old boy presented with diplopia. What is your diagnosis? See you in the next class.